Epilepsy is a common neurological condition that causes children to have seizures. Some children who have epilepsy continue to have seizures despite taking anti-seizure medications. For children with medication-resistant epilepsy, surgery may be offered to disconnect or remove the abnormal area of brain that is causing the seizures. Neuromodulation is an alternative therapy that delivers stimulation to the brain to reduce seizure frequency. Around 70% of children become free of seizures after epilepsy surgery. However, 30% of children continue to have seizures, and the reasons are so far unclear. Here, at UCL, researchers are working towards maximizing the success of epilepsy surgery for children using advanced neuroimaging and surgical techniques.
Deep brain stimulation, DBS, is an advanced form of brain surgery that aims to reduce seizure frequency for children with drug-resistant epilepsy. Deep brain stimulation involves passing electrodes directly into the brain and stimulating at critical regions in order to stop the spread of epileptic activity and to stop the patients from having seizures. At the UCL Great Ormond Street Institute of Child Health, we're leading the CADET trial, which will investigate the ability of deep brain stimulation to treat children with Lennox-Gastaut syndrome, a rare yet severe form of childhood epilepsy. Through the CADET trial, we are aiming to establish deep brain stimulation as an effective form of therapy for children with drug-resistant epilepsy to reduce their seizure frequency and to improve their quality of life.
As well as looking at seizure outcomes in children with epilepsy, we're also interested in their cognition. So specifically how they can learn and how their memory and language functions develop. We're specifically interested in identifying what patients have declines in these functions after surgery. And ideally we'd like to be able to predict IQ, memory and language declines before these patients go to surgery in order to better inform the clinical team for decision making.
We are increasing our efforts to improve the success rate of surgery. For example, we are using artificial intelligence methods to identify abnormalities in the brain that clinicians previously were not able to detect. Being able to follow these children up after their surgery, the majority of them have an improved development of their cognitive and educational abilities.